Hi everyone, welcome back to my YouTube channel. Today we are going to talk about tumors of lungs. So let's start our topic with introduction. Squamous cell carcinoma is malignant tumor that arises from squamous epithelial cells of skin, mucous membrane and other organs lined by squamous epithelium. It is second most common type of skin cancer after basal cell carcinoma, but can also develop in lungs, cervix, esophagus, and oral cavity. Squamous cell carcinoma is known for its invasive potential and risk of metastasis if not diagnosed and treated early. Etiology and risk factors of squamous cell carcinoma. The development of squamous cell carcinoma is multifactorial, with both environmental and genetic factors contributing. The major risk factors include ultraviolet radiation exposure, that is, chronic sun exposure, and tanning beds that can lead to cutaneous squamous cell carcinoma. Second risk factor for squamous cell carcinoma is exposure, like arsenic, hydrocarbons, and industrial chemicals that may increase the risk of squamous cell carcinoma. Third is radiation, that is prolonged exposure to ionizing radiation, and it can predispose to squamous cell carcinoma. Fourth risk factor is chronic inflammation, as non-healing wounds, scars, and chronic ulcer may develop into squamous cell carcinoma. Fifth risk factor is immunosuppression, as organ transplant patients or those on long-term immunosuppressant are at higher risk of squamous cell carcinoma. Sixth risk factor is human papillomavirus infection, as certain high-risk human papillomavirus strains are strongly linked to squamous cell carcinoma of the cervix, oropharynx, and anogenital region. Seventh significance is risk factor is genetic factor, as mutation in tumor suppressor genes such as p53 are common in squamous cell carcinoma. Pathogenesis of squamous cell carcinoma. Squamous cell carcinoma originates from uncontrolled proliferation of keratinocytes. It is because of DNA damage, and damage may be because of UV radiation that induce mutation in tumor suppressor gene and oncogenes. Then it causes dysplasia to carcinoma sequence, as squamous cell carcinoma often develops from precursor lesions such as actinic keratosis or leukoplakia. Then third step of squamous cell carcinoma is invasion, that is when malignant squamous cell breach the basement membrane and infiltrate the underlying tissue. Fourth step is metastasis, as spread occurs primarily through lymphatics to regional lymph nodes, and in advanced cases distant metastasis to lungs, livers or bones can happen. Clinical features of tumors of lung. The presentation depends on the site of involvement. If it is cutaneous squamous cell carcinoma, oral and oropharyngeal squamous cell carcinoma, cervical squamous cell carcinoma, esophageal squamous cell carcinoma. Clinical features of cutaneous squamous cell carcinoma include film, raised, scaly nodule or plaque, and it may accelerate or bleed or crust. It is commonly found on sun-exposed areas such as face, scalp, ear, and hands. Second type of squamous cell carcinoma is oral and oropharyngeal squamous cell carcinoma. It is when there is non-healing ulcer, leukoplakia, or erythroplakia. In this, there is pain and difficulty in swallowing, and speech problem in advanced cases is there. Third type is cervical squamous cell carcinoma. That is when there is abnormal vaginal bleeding and postcoital bleeding and pelvic pain. It is often detected early through pap smear screening. Fifth type is esophageal squamous cell carcinoma. It is there is progressive dysphagia, that is difficulty swallowing, and it is associated with weight loss, chest pain, or hoarseness in advanced stages. Diagnosis of carcinoma. Acute diagnosis of squamous cell carcinoma requires a combination of clinical evaluation and laboratory investigation. First we do is history and physical examination that include evaluation of risk factor, lesion duration and systemic symptoms. Second we do is biopsy, that is gold standard for squamous cell carcinoma, and its types include excisional biopsy, incision biopsy and punch biopsy. Histopathology reveals keratin pearls, intracellular bridges, and atypical squamous cells. Third, we can do is imaging studies that include CT, MRI, or PET scans for staging and metastasis detection. Fourth, we can do is cytology, that is pap smear in cervical squamous cell carcinoma, or fine needle aspiration cytology for metastatic lymph nodules. Histopathology. Squamous cell carcinoma has characteristic microscopic features that include dysplastic squamous cells with enlarged and hyperchromatic nuclei, presence of keratin pearls, that is concentric layers of keratin, intracellular bridges, and evidence of invasion beyond the basement membrane. Staging. Squamous cell carcinoma is staged using the TNM classification, that is tumor, node, and metastasis classification. T is for tumor, that is basically size and local extent of the lesion. N is for node, that is basically represent presence of lymph node metastasis, and M is metastasis, that represent distance spread. Treatment. Management of it depends on the size, location, and stage of tumor. We can do surgical excision, that is wide local excision with clear margins in treatment of choice for most cases. But we can also do most micrographic surgery, that is especially useful for facial squamous cell carcinoma where tissue conservation is critical. We can also do radiation therapy, that is effective for unresectable tumors or in combination with surgery. It can be done. Then we can do chemotherapy, that is used for advanced or metastatic squamous cell carcinoma, and it is often with agents such as cisplatin and 5-fluorouracil. We can also do immunotherapy, that is immune checkpoint inhibitors, and they slow promise in the advanced cases. Prognosis. Prognosis of squamous cell carcinoma depends on early detection and treatment. And if they are well differentiated tumor, they have good prognosis. But if they are poorly differentiated or advanced stage tumors, they have high recurrence and metastasis rate. Cutaneous squamous cell carcinoma generally has a favorable outcome, whereas squamous cell carcinoma of internal organs like esophagus, cervix, and lungs carries a poor prognosis if diagnosed late. Prevention. Prevention is done by avoiding excessive sun exposure and use protective clothing and sunscreen. Prevention is by regular skin self-examination and dermatological checkups. Prevention can be done by HPV vaccination to reduce cervical and oropharyngeal squamous cell carcinoma risk. Prevention can be done by avoiding tobacco, alcohol, and exposure to carcinogenic chemicals. And also by early detection and treatment of precancerous lesion, these carcinomas can be avoided or prevented. Conclusion of this lecture video. Squamous cell carcinoma is a significant public health concern due to its higher incidence and potential for metastasis. With raising UV exposure and lifestyle-related risk factors, the burden of squamous cell carcinoma continue to increase worldwide. And early detection, appropriate treatment, and preventive measures are crucial for improving survival rates and quality of life in the affected individuals. And this was all about squamous cell carcinoma. Hopefully you liked the video, and tumors of lung also. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.